Hi, my name's Kimmile, and I actually live in Stockton Springs, Maine. It's quite a ways from Arizona. And I was first diagnosed with breast cancer this past summer in August. I felt a lump that kind of came up all of a sudden, and I wasn't really sure what was going on. So went in, had it checked out, and this is what they were telling me. It was cancer, and you have to do this, you have to do surgery, you have to do chemotherapy, you have to do radiation, you have to do all of these things. Well, it's kind of a whirlwind of information. It was really difficult to receive that information. I mean, I'm 47 years old. I have 3 children, and they're young yet. I mean, 14, 12, and 11. I mean, they still need their mother around. So I knew that the traditional path, recommended path of all the treatments of chemotherapy and radiation were not the right path for me. In my opinion, radiation is cumulative, so I haven't even had mammograms in quite a few years. I don't like dental x-rays, all of those kind of things. I mean, we're exposed to enough radiation throughout our lives just through normal, everyday living. Chemotherapy is a poison. I mean, it just is, and I've told a lot of people, it's kind of like mowing your lawn to get you have a few dandelions in your yard. So you want to get rid of these dandelions, so you bring out a bulldozer, and you're going to get the dandelions, but you're also going to kill the grass. So that's the way I look at traditional chemotherapy. And I knew that there was an answer, an alternative out there, and I just didn't know what that was. When you get on Google and you're doing all this reading and you're looking for something, it's really difficult to find anyone that would say, oh yeah, I can cure cancer, or this, that, or the other. They can lose their license, and I certainly understand that. So that all the traditional medical world has to offer is this chemotherapy and radiation. Oh, this is the best thing that we found. Well, cancer is a big business in this country. So there's never going to be a cure for cancer as far as the allopathic world is concerned, because this is what the alternative is. I go into a cancer treatment center to speak to a traditional oncologist just to get information. And there's a lot of people sitting around that don't have their hair, and they just, obviously their skin color is really bad, and they're one lady was sitting there furiously eating a brownie before she was going to go in for chemo treatment. And I thought, oh my gosh, that can't be good for you, never mind. She has cancer and she's shoveling this brownie in, but I guess and I've heard from other patients that they would have boxes of donuts sitting out, and the idea was to put weight on these people, not realizing that sugar feeds the cancer, which is something that I learned about here. And I already knew about the acid-alkaline balance. I had been doing quite a bit of reading on that cancer can't survive in an alkaline environment. So I had already started becoming vegan, stopped the meat, stopped the dairy, eating a lot more vegetables, although they were cooked, not really understanding that piece of it at that time in my life. But I had seen a couple of YouTube videos about Dr. Lodi, and I thought he was really interesting and a very passionate, dynamic speaker, and it was refreshing actually to find someone who was as passionate about their beliefs as I was or am. So I ended up calling the clinic. I thought, well, what have I got to lose? And I talked to a staff member here, and Colleen was the staff member. She's a new patient coordinator that ended up answering the phone. And I must have talked to her 5 different times. I had this list of questions, and she'd answer them all, and then I would call back, a couple of days later with a new, fresh set of questions. Always patient, always willing to, if she didn't know the answer, they would find the answer. I had some basic knowledge of supplements before because I had been trying to fix this cancer myself, supporting my body nutritionally. And I spoke with Julia, who's the supplement queen here, and she was also very helpful, encouraged me to email her with all of my questions, and she was researching all the information and getting back to me. So everyone has been really nice, and Dr. Lodi called me a couple of times, and usually you don't have the doctor call you, it's somebody from the staff or a nurse or somebody like that. But he actually called me in person a couple of times.